Today's live is starting now. And if you're joining me, let me know that you can hear me and you can see me without any issues. My name is Desiree Djanie. I am an advanced hair, scalp, and skin practitioner here in Leicester in the UK. And I have been coming live for the month of June, and I shall be continuing for the rest of the month of June, discussing all matters to do with your hair, scalp, and skin, and really delving into the details and educational benefits for knowing what these things are as pertaining to you. Hi, Eileen. I love it when people come and say hello. Thank you for watching. So excited, Eileen, that you're here. So I will be talking about these things because I find that people need to know about it and they don't quite understand what is happening with their hair, scalp, and skin. And that's how people like me become useful. And I am trying to give you some value here to make sure that you are getting what you need to know about your own hair, scalp, and skin, at least until you go and see a professional who knows what they're talking about. It has to be someone who knows what they are talking about. And so what I do within my business is to help people to combat any ailments and hair and scalp disorders that they may have, and so that I can help fix that for them, alleviate any issues that they're going through, and help them on their journey to getting beautiful hair, scalp, and skin. Okay, so my services are really based on compassion, in the sense that I had a discussion with another one of my viewers yesterday, and we discussed that really what I'm doing is trying to help people where they are. So exactly where they are is where I come in and I help you from there. The idea is to not try and get you to do something that you're not used to doing, and sort of rush you and accelerate your process from one end to the other. It's just to hold your hand, and so that when you're ready to make a transition over to a different area of skincare and scalp care and hair care, that I will be there to guide you through it. So if the client comes to me and they are really just interested in having chemical treatments, it's fine. How do I do so in making sure that you are getting the best hair, scalp, and skin treatments that you can have where you are at the moment? So if you're wanting to have relaxers, where do we come in? Where do I come in to help you get the best relaxer that does not really affect your hair, scalp, and your skin in damaging it? Or how do we make sure that we educate you well enough so that you can go on and have the great home care and aftercare that you need to make sure that your hair and scalp is left balanced and healthy? So compassion is number one. I'm just looking at my notes so I don't forget anything. If you're here, just say hi. Please say hi to me. Just type it. There's no pressure to come on and speak to me. Max says hi. Hello. Thank you for joining. Please just ask any questions if you have any. I am here to answer them. And if I can't today, I'll make sure to do so in a future live. Okay. So I'm going to start with talking about the skin. I think I want to start with that today, just so that we can switch things around a little bit. And people have started really using some of the advice that I'm giving here, and I'm so pleased with that. And they are starting to look after their skin. They're starting to engage in some skincare practices that makes me so happy. Sometimes people forget that some things they've been doing have actually helped them, and these are just things that are nudging them in the right direction to make sure that they're doing the right thing. Okay, so skin types. People get confused as to what is going on with their skin types. We have 5 main skin types, which is oily skin, sensitive skin. We have oily skin, combination skin, dry skin, sensitive skin, and combination skin. I hope I've named them all. So oily, dry, combination, sensitive, and normal skin. Oily, dry, combination, sensitive, and normal skin. 5 skin types, okay? So if you fall within that category of 5 skin types, this is what you naturally have. This is the skin type you naturally have. You inherently are of this skin type. You were born with it. And so that is who you are. So we're going to start by talking about oily skin. Or perhaps I should start with normal because it's easier to just work off that. Okay, so we'll start with normal. Normal skin is where the skin is balanced. The skin is not too oily, neither is it too dry. So, and really, we don't see any imperfections in the skin. The skin appears balanced, smooth. There aren't any enlarged pores, for example. There aren't acne in the forehead, for example. The skin is just balanced. It's just normal skin. It doesn't react. It doesn't do anything. It just is a happy skin. Okay. So that is where we're going to build the rest of this life on from. And then we go on to oily skin. So oily skin is just naturally oily skin that just seems to be really shiny and creating a lot of sebum. Okay, so we discussed sebum. The sebum production happens in the scalp, in the dermis of the scalp, where we are getting a lot of beautiful, waxy substance that's got esters and ceramides and things like that in there that helps to create a lovely environment for the scalp. But the same sebum is on the skin also. So you'll find that when we're born, we are born with lovely balanced sebum. And then when we get to our puberties, it just rises completely. And then we get oily skin, which then becomes, sort of acne prone. And then during menopause, it goes downhill, which is slightly earlier for men. But for women, during menopause, that sebum production just declines. Okay. So oily skin is where you just find that your skin is shiny, you have enlarged pores, you may experience some issues with it, but the skin type in itself, so this is the type, the characteristics of the skin type that you're born with. If it is oily, this is how it presents itself. Okay, so it's just oily. You're noticing that you get a lot of shine, for example, all over the skin, in the major areas, right? And then we have combination skin, which means that the skin itself has got a combination of things happening. One of the things I struggle with is when people think the combination skin just basically means that the skin is oily on the forehead, nose, and chin, and dry in the cheeks. But combination skin actually means that the skin has got a combination of things happening to it at the same time, at one time, right? So it could be that there is acne, or there is many things happening in the skin at the same time. You've got oily T-zone, you've got dry areas. It could be that you've got dry, forehead, but oily in the middle, or you've got oilier cheeks. So long as it's a combination of skin characteristics, then you have got a combination skin type. And then we've got sensitive skin. So sensitive skin, it's a skin type that is highly reactive. You find that you do something little to it, or you just try something new and it just cannot cope. It is usually itchy. It becomes dry very quickly. It starts to burn if you use certain things on it, and it doesn't cope well with it. It starts to burn and sting, and then it shows itself through dryness also. Okay, so we've done normal, combination, oily, dry skin. So dry skin is just generally dry, and then we've done sensitive skin. Okay, so these are the 5 main skin types. So that is the type of skin you were born with. Now we need to talk about the conditions. Now, conditions are things that happen to your skin which isn't actually what your skin type is. It's just a condition that has happened to your skin, something that has happened to your skin. It could be chronic, it could be short-lived. So when I speak about chronic conditions, I'm talking about things that are long-term or long-lasting. Anything over 3 months is something we consider medically long-term and chronic. Okay. Now we're talking about medical things. I need to caveat, I am not a doctor. I am not your doctor, and I'm not your GP. And so anything that I discuss today is for educational purposes. And so if you need anyone to help you to diagnose properly what is happening to you with your hair, scalp, and skin, please make sure you consult with your GP who knows everything about you. Okay, so do that first. And obviously, if you need some treatments from someone like me, you know where to find me at Vegan Hair Salon UK on all the social media platforms. Okay, so we're going to talk about skin conditions. These are the things that just appear. They appear through life. We just see that our skin type changes, or the skin itself changes in condition. So we have acne, for example, that just comes on during puberty, for example, and then we have acne that occurs during menopausal years for women. Okay, and we have eczema, for example. That's also another skin condition, which can be short-lived or can be chronic. We have psoriasis, which is just when the skin cells are just overactive and there's a high skin cell turnover. Okay, so among black skin, psoriasis appears to be dark purpley grayish color, and on white skin or Caucasian skin, it appears to be reddish, scaly, and sometimes silvery as well. Okay, and it's very, very thick in nature. So psoriasis is also a skin condition, right? Psoriasis, we find that it's usually chronic, so it's long term, and we need to treat that. We still yet are to know why psoriasis occur. There is not a consensus as to what happens with psoriasis or how it actually what causes it, but we know that there are things that can exacerbate the condition of psoriasis. So things like stress can make it worse. If you smoke, certain medications can also make the psoriasis condition worse. Okay, so those are the external factors to do with psoriasis, right? And then things like other conditions such as vitiligo, for example, where there is the hypopigmentation of the skin. So there's light patches of the skin in certain areas, irregular areas of the skin. Hyperpigmentation is when we have darkening. Hypopigmentation is when we have lightening of certain areas of the skin. And that's where vitiligo comes in. So that is also a skin condition, not a skin type. So you will find that there'll be people who may have dry skin but have vitiligo, or they have combination skin and have eczema, or have dry skin and have eczema, or they have sensitive skin but do not have eczema at all, but may have a different sort of condition, such as acne, for example. So we need to know what the differences are. The skin types are what you were born with. It's usually to do with nature, how you are born, what you naturally inherited in your genes, for example. And then the conditions are the things that happened extrinsically to you through your environment or through issues that happen to your body over a period of time. Okay, so really important that we know these things and how to look after them. So how to look after skin that has say dryness, for example, is to make sure that we're looking after the skin, we're protecting the skin. We do that through using hyaluronic acid, for example. These are the actives that I've mentioned in the past, and they grab hold of moisture from the outer source or the nearest source, up to 1,000 times their weight in moisture. Okay, and so they help to hydrate the skin and keep the skin nice and supple. And then we have combination skin, for example, where we need to tackle the areas of what is happening within the skin. If it's an oily T-zone, we need to make sure that our masks, for example, are sympathetic to that. So you're using masks that are really kind of absorbing moisture, that are really good at extracting those sebum waxy substances from the T-zone, and whatever the other conditions are. If it's dry cheeks, for example, you're putting a highly hydrating mask around the cheeks. So don't be afraid to treat your skin according to what it needs. You don't necessarily just have to use one product all over the skin. If you need to spot treat, you need to spot treat. You just have to make sure that you're giving the skin what it needs. Okay. And then when we have sensitive skin, for example, we must protect the skin. Some actives that we like to use for things like that is vitamin A, which is really beautiful at making sure that the skin is balanced and is resistant to the environment, for example. And it helps to calm certain things down, such as sensitivity, and also helps to turn the skin over, the cell over really beautifully, and it balances it out as well. It regulates those skin cell turnovers. Okay, and then what else do we have? Acne prone skin. So we try to deal with some of these things. If it's very vicious, we deal with this internal and external. Most of these things that I'm talking about, we deal with it, on a double prong attack, for example. But acne, to be precise, we tend to deal with that internally, because we want to make sure that we're balancing that sebum out. We want to make sure that we're not leaving the skin pores open to enlargement. And so we have to tackle that really well. And we tend to use the advanced nutrition program for that. We use the skin Acumax, and we use some of the biomes to make sure that your gut is happy. So we use the pro, the pre, and the post biome strains to make sure that you are balanced and your gut is happy. And then we can sort out any of those acne conditions. If you're hearing me and I'm still fine, just let's keep going. Let's keep going. Okay, so we're going to move on quickly to the importance of curl pattern and hair typing. So we have hair types, for example, and then we have the characteristics. We have the classifications, and then we have the characteristics. One moment, I need to plug. I'm so sorry. Let's see if I can do this without any interference. Okay. I'm running out of charge. I think I have spoken without my mic on all this time. I'm so sorry. Can anybody hear me? Can you hear me now? Okay, for the sake of the fact that I think I may have got I may have had my mic turned off, I'm just going to go over the protective styling because I don't know how long I've not had my mic on all this time. So we spoke about protective styling in the sense that we're um, looking after the hair and making sure that the hair that is in protective styling is actually protected for the period that it's in that style for. So I spoke about the elements that your protective style should have, which I said that it has to be non-drying, it has to be protective, so it must protect you from mechanical damage. It must also protect you from manipulation. It has to be able to provide you with the opportunity to reveal the scalp and treat it. It has to provide you with the opportunity to ventilate the scalp area. Um, and you should be able to do certain things that you need to do for your hair before you put it in that style. So bearing in mind that if your hair is not strong enough or your scalp is not strong enough, you should not be engaging in certain protective styling, right? So scalp revelation basically means that you're making sure that the scalp that is revealed when you've got your protective styling gives you an opportunity to treat your scalp during the time that it's in that protective style for. So if you've been prescribed by me or advised by me to have a protective style for, say, 3 weeks or 4 weeks, because of your scalp and hair type and condition that you have, or characteristics, sorry, of your hair that you have, I will make the bespoke advice to you to help you know that you perhaps cannot have a protective style for 6 weeks, that this is perhaps how long you can have your protective style for, because you need to take it out and we need to be able to wash your hair and cleanse your scalp as well. So everything we do in clinic is bespoke. It is tailored to you as a patient, as a client. Through our consultation, we get to know who you are, what you do, what your hobbies are, what your lifestyle is, and then we make a plan that helps you out. Okay. Then I spoke about the fact that treatments um, before you have your protective styles are important. If you are lacking in moisture and you're lacking in proteins, make sure that you're doing that before you have your protective style. You're having a good moisture protein balance before you put protective styles in. And this goes out to both men and women. If you're a man and you're doing this and you're putting your hair in braids, we need to consider all of this too. This is not just for one, group of people. It is for everybody. Yeah. So cleansing opportunities are things that you should look out for as an element in your protective style. Scalp revelation opportunities, scalp ventilation opportunities are also important. So we make sure that the scalp is ventilated so that there is no buildup of mildew, bacteria, and dead skin cells, debris just living on the scalp, and that we can't do anything about it. When your hair is also in the protective style, it's important to ensure that you are cleaning it. You can clean the scalp whilst it's in protective style. You can clean the hair while it's in protective style. You can treat the hair and treat the scalp while it's in protective styling. That needs to be able to happen. If you have a hobby, for example, that involves swimming and things like that, there are things that you can do also to stop the degradation of proteins in the hair from the chlorine, for example. You make sure that we coat the hair and we protect the hair before you use the pool. And for cleaning the scalp, for example, when it's in protective style, we just advise that clients use we just advise the clients use a concentration nozzle bottle. So a bottle with a concentration nozzle. So these are the very pointed tips. And then you put your shampoo in there with some water, shake it until it is emulsified, you direct it to the scalp, you put it in, and you just use the pats of your fingers and really work the product into the scalp in short strokes whilst the hair and scalp is in protective styling. And you do that to cleanse the hair and scalp. Yeah, so you do that for the scalp, for example, you rinse it off. If not, you do the same. Sorry, of course, you would do that for the scalp. And then when you finish, you do the same for the hair. You pour the product on the hair and you wash the hair off. Okay, so you're getting all those products off the hair. Sorry, you're getting all those impurities off the hair and scalp. Then I spoke about the fact that being having a protective style isn't necessarily a hands-off approach. It really is just so that you stop manipulating the hair, and manipulation, mechanical damage and manipulation just occurs when you are combing the hair aggressively, for example, or frequently. So when you're having a protective style, the idea is to just get your hands off for a short while, whilst you just maintain the hair in the style that is in. But if you're needing to mechanically go through the hair every time, it can sometimes cause mechanical damage. So the mechanical damage, as I've explained, is the actual activity of mechanically going through your hair by brushing or plaiting or twisting or anything that you're doing, that you're managing your hair day to day, is what we call mechanical damage. And then manipulation is also obviously manipulating the hair into a style that you're looking for day to day. Okay. And we spoke about if a client is, or a patient is being admitted to hospital, for example, and they're wanting to make sure that when they come out of hospital that they are okay and that their scalp is not inflamed or their hair is not severely damaged. We've put them on a program that helps them so that when they come back, and they are, they are no longer admitted in hospital, they can resume their hair care journey without any adverse effects on them because of their admission to hospital. So that would be it for now. And I am going to end here by saying that we have, I hope you heard everything I said. I feel a little bit worried because I've been videoing and my mic wasn't on. And I thought that Magdalene said we can hear you. And yet I couldn't. I realized that my mic was off. So I hope you heard everything that I said. I was speaking for a while and I hope that it was recorded. But I'll do a quick recap. We spoke about the skin types. We spoke about the 5 skin types, which is oily, dry, combination, sensitive, and what did we say? Oily, dry, combination, sensitive, and there's one more. Why have I forgotten? I have got. Oh, and normal, of course. Oily, dry, sensitive, combination, and normal skin types. So those are the 5 skin types. And then we have the conditions of the skin, which would be acne, for example, eczema, psoriasis, rosacea, vitiligo. These are the things that happen to the skin. So the skin types are what the skin actually is. This is what the skin actually is. This is how you were born. Is usually something that you through your genetics or you inherited or whatever. If you inherit good skin, great. But there are times when conditions can happen to you. So you may develop a condition called eczema, for example, or acne, where there is, overactive sebum production, which is the same sebum that is produced in the hair. It's the same sebum that is produced in the skin. So these are the conditions that we talk about. So psoriasis, for example, is a skin condition that appears to be red, flaky, sometimes even scaly and silvery in the way it appears on white skin types, but on afro skin and black skin, it is purpley brown and and gray rather. So that's how it looks, and it's the thickening of the skin. It seems quite thickened, and it's just over production of skin cells. And then we spoke about eczema and um, what else do we speak about? Vitiligo being the fact that it is the absence of pigmentation in the skin, so the melanin in the skin is no longer uh, there. So hyperpigmentation is when we have the darkening of certain areas of the skin, and then hypopigmentation is when we have no pigment, or we're losing patches of pigment in the skin. So that's what vitiligo is. So these are the skin conditions, and then we have the skin types, and knowing what they are really helps you to make sure that you are helping yourself in selecting products. So if you've got dry skin, for example, you'll make sure that your products are nourishing and hydrating. So you'll be using things like hyaluronic acid, for example. You'll be using humectants to make sure that you're drawing moisture from the largest source into the skin. And if you've got combination skin, for example, you'll make sure that you're treating the hair adequately. Sorry, you're treating the skin adequately. So if you've got combination skin, people ordinarily think that it's just oily T-zone, which is the forehead, nose, and chin. But we have found that the combination skin conditions can present themselves in all sorts. So we could have oily areas, but we can also have dry areas where we typically would have thought would be oily. So you may find that perhaps sometimes the cheeks are oilier when they wouldn't have been before, but the forehead seems to be drier, and the nose is oily, and the chin is oily. So please don't rely on the fact that you're looking for an oily T-zone and dry cheeks to diagnose that you have got a combination skin type, right? So making sure that we know what we're looking for. So dry skin is lacking in moisture and hydration. Combination skin will need a combination of treatments. So don't be shy in using the right treatments for the right area. So if you're having to use a combination of treatments, so you're using something that it's maybe a drying mask to dry out the T-zone of the forehead, the nose, and the chin, be sure to use something that is hydrating if your cheeks are dry, okay? Or vice versa, whatever the case may be. And then where you have normal skin, which is just great because the skin is just balanced in both, it's not oily and it's not dry, it's just normal and balanced, then you can use normal skin type products for your skin. Sensitive skin is also another skin type where the skin just sometimes appear itchy, flaky, really sensitive. It starts to burn. It becomes tight and dry when you've cleansed it, for example. So with those skin conditions, we like to treat that with vitamin A, for example, to make sure that you are building that resistance in the skin, and the skin can withstand the elements of the environment. So we've spoken about dry skin, combination skin, normal skin, oily skin, and sensitive skin. These are the skin types, the 5 skin types, and then the conditions are what I have mentioned already. I'm only going over this because I noticed that my mic was off and I was speaking for some time and I didn't realize that no one could hear me. And so I'm going over it again. But if there are no questions, it's been 50 minutes and still counting. And I would just like to say thank you for joining me. It has been a pleasure. We are on day 10. We've got 20 more to go. And I love everyone that's been joining me. Thank you so much. But for now, I'm going to have to say all my love and goodbye and good night.